Bonjour, je m'appelle Scott Boden et mon cabinet médical se situe dans le Connecticut, aux États-Unis. Je tiens à remercier Lisa et l'organisateur de SkillMed et je suis honoré de participer à cette conférence. Excusez-moi, je devrais continuer à parler en anglais. Désolé. Hello, and thank you so much for allowing me to participate. I'm Scott Boden from Connecticut in the United States. We'll talk about hair loss medications, Minoxidil, Finasteride, and more. Thank you for the organizers. I am a member of the International Society of Hair Restoration Surgeons and a fellow of the American Board of Hair Restoration Surgeons. I have no conflict of interest. Let's talk about kind of some basic stuff first. We'll move quickly through this. What are we here to learn about? Let's talk about androgenetic alopecia. This is a genetically predetermined disorder due to excessive response to androgens. Most men and more than a third of women by age 50 will experience some form of hair loss due to androgenetic alopecia. Progressive hair loss of the terminal hairs begins anytime after puberty. It's polygenic in terms of how we inherit this, both from mom and dad. There's a hormonal influence. The dihydrotestosterone affects susceptible hair follicles and they begin to miniaturize. In women, particularly postmenopausal, as estrogen levels drop and androgens become more predominant, we see more female pattern hair loss developing in a postmenopausal state. What happens with exposure to DHT is progressive shortening of the anagen phase and elongation or prolongation of the telogen phase, and that's how hairs get miniaturized over time. Typical presentation is men begin to thin from the front as well as in the crown. Women can experience that as well, but also more diffuse female pattern is more common. First and foremost, we need to know if we're treating androgenetic alopecia. So look under a dermatoscope, evaluate carefully. Don't assume that androgenetic alopecia is the only reason for hair loss that you're seeing. Ask the patient about family history. Look out for other causes of hair loss, including telogen effluvium, certain inflammatory or autoimmune conditions, hypothyroidism, vitamin D deficiency. There are many other etiologies for hair loss. What are we talking about today? My talk is really devoted to addressing the non-surgical approaches. That's what this is about. You'll have an opportunity to learn about surgical approaches, and other colleagues will talk about some emerging therapies which are not really the scope of this talk today. I always tell my patients that hair transplant is the last option. Of course, I offer hair transplant, but I take an aggressive, conservative approach, an approach that includes a lot of medical therapies, and we'll talk about those now. I tell patients it's in their best interest to do everything medically advisable so that you can maintain and potentially improve what you have. What are some questions to start with? First, what has a patient used previously? Are you going to succeed next week? No, it takes 3 to 4 months to see if the hair is stabilized and 6 to 12 months to see if there's improvement. Initial shedding may occur. It's very important to tell your patients that when you initiate hair growth therapies, you may see some shedding initially, and that's sometimes, paradoxically, that's often a sign of a good response when you see initial shedding. I tell people not everybody will see new growth, but if we can stop the loss, put the brakes on, that's a successful outcome. We want to also go into how these medications work. I tell patients, I try to motivate patients to embrace the medical therapy, and we describe medications as insurance against further hair loss. I think I'll shrink myself down again. This is a young guy who did not have a transplant. He's only 19 years old. He felt devastated, despondent. He didn't want to leave the house. He felt that he was going to be bald like his dad, although his dad didn't go bald until he was in his 40s. So before any surgical approach. We tried medicine, and he's doing very well with medicines only. So